Environment and anti-tobacco activists say policy interference from tobacco companies is frustrating government's efforts at controlling the use of tobacco in Africa. According to the activists, such interference has either compounded legislative processes or rendered existing laws controlling the use of tobacco ineffective. They are seeking the enactment of laws that will control and prescribe stiff punishments for the use of tobacco and prevent death of smokers and non-smokers who inhale tobacco smoke in the country.
Health experts, environmental activists and officials of the Federal Ministry of Health and the World Health Organization convened at a forum on how to make anti-tobacco laws effective in the country. They are seeking enabling laws that will control the use of tobacco despite policy interference from tobacco companies. According to the organizers of this forum, stiffer legislation must be put in place to protect from tobacco-related diseases, which they say kill more Africans than HIV/AIDS, tuberculosis and malaria combined.
We had gotten the bill passed before, but it was not signed by the president. We wouldn't rule out the interference of the tobacco industry. When you look at their activities today, you find them doing all manners of underhand practices under the guise of corporate social responsibility. We've seen them, marketing regulations to states because they want to enact smoke-free laws.
We do know that it's very, very critical that we prevent tobacco industry interference in our tobacco control legislation, because the industry will be there. Tobacco industry is always there. They're always going to be interfering. They're going to be talking to our legislators. They're going to be talking to our policymakers. It's important that our policymakers and legislators understand that this is about public health. Then it's their responsibility to protect the millions of lives of Nigerians.
The Federal Ministry of Health is currently sponsoring a bill at the National Assembly which, when signed into law, will provide stiffer control on the use of tobacco. Ultimately, the ministry says it hopes to eradicate tobacco use because of its health hazards.
One of the risk factors for non-communicable diseases is tobacco consumption, which we are trying to eliminate eventually. So the control is a process, actually. The terminal is in eliminating this completely because responsible for many metabolic disorders.
Analysts say over 20 billion sticks of cigarette are consumed in Nigeria annually, exposing both smokers and non-smokers who inhale cigarette smokes to risks of contracting cardiovascular diseases, cancer and other chronic lung diseases.